The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom Roselle here. Welcome to Asia's Health Livestream. We're going to continue a process of talking about depression, and maybe we'll touch on anxiety as well. But I want to get into a couple things with you, because did you know that 1 out of every 4 Americans, actually the number is bigger than that, has been diagnosed with depression, and the drugs that they're on are actually causing it to become worse over a period of time? So the question becomes, is that normal? I'm here to tell you that it's not. And we're living in a world right now where we're being exposed to so many different things. This is truly a situation where you look at the triad of health that I talk about all the time, the structural piece, which is neurology, the biochemical, bioelectrical piece, and the emotional piece, or the decision processing that we make about everything and anything in our lives. So as we go through the process today, I want to distinguish some very specific characteristics about what depression is and why, more importantly, that we're getting into it. And in addition to that, what can be done about it other than consuming a huge numbers of drugs. And if this doesn't work, let's go to this one. If this doesn't work, let's go to this one. And they all have tremendous side effects without truly understanding the triggering mechanisms. And one of the things that you can do, and I'm going to give you that as we go through the program, to begin to turn this craziness around. You need to ask your doctor very specific questions when you go in and you complain, well, I'm anxious, or, I'm down and nothing seems right. You have to take a really good look at one, why that is. What's the lifestyle? Not just, check a list of, okay, you have this, you have this, you have this, so you must be depressed. So let's put you on this drug, Abilify or whatever it is, and see how you respond to it. Well, if that doesn't work, let's do something else. It's a trench, it's a hole, it's a suction cup that brings you deeper and deeper and deeper and deeper. And I have patients who have been on all kinds of medications for decades, and they come in and their health is totally destroyed. I don't think any of us want to live that way. So let's begin to explore the subject. And I want you to remember that coming up at the Roselle Center for Healing in Fairfax this coming month, the 18th of June, within a couple of weeks, right, at 6 p.m., Dr. Stephanie Pina and Annabeth Goss are going to be talking about this specific subject. They're going to teach you. Many of you know Dr. Stephanie Pina. She's a naturopathic physician, and Annabeth is a great nutritionist. And the combination of two, they're going to tell you how to get around this stress, anxiety, depression pattern with changing a few things that we do every day. It's called what? Eat. So we want to make sure that we understand that and the things that we can do about that. But I'm going to give you some other pieces of the puzzle. So let's get into the program a bit and talk about, why we have all these crazy things going on. So when you talk about depression, there are biological factors that cause depression. And, those can be some genetic susceptibilities. It could be some problems with brain transmission, but those are very, very rare. Yeah, my grandmother was depressed, my mother was depressed, and so forth. But could that be because it's familial, not genetic? What does familial opposed to genetic mean? Familial means that I grew up in the same family, and everybody does the same thing, and everybody's exposed to the same stuff. It's like if you put a puppy in a group of ducks, pretty soon the puppy thinks it's a duck, and it walks like a duck, it waddles a little bit and so forth. That's a familial factor. That's a group think type of, actually it's more than group think. It's something that continues a process. How about, excuse me, psychological factors? So you could have had something happen early in life, trauma, something horrific took place. So some people are able to get through and use it to their betterment, and some people succumb to it. But personality traits can contribute to that as well. So something egregious happened when you were very, very young. It could be a physical abuse psychologically. It could be an emotional abuse psychologically. Somebody put you down, made you feel, extremely vulnerable and so forth. So you live with that, but you interpret everything through that lens. And so if you go to somebody and says, well, what do you think about that? Well, you've been emotionalized that for years. The bottom line becomes, what are you going to do about it? We have a health coach in the office, and she deals with that on that basis. What are you going to do about it? Not what do you think about it, but what are you going to do about it? Let's put a game plan together. Is it difficult sometimes to get through the weeds? You bet it is. But in addition, it gives you the tools, and wouldn't it be nice to be incrementally stronger, better, more capable, more able to be able to put things together? I think so, because there's not one of us that haven't had something that has occurred over time. But how we handle that, what we decide about that, what we do about that is a whole different story. How about environmental factors? Okay, what are environmental factors? Those things come like stressful situations that occur. You lose somebody, right? Suddenly somebody dies. In the world of post-COVID, we're seeing a lot of that, unfortunately. And somebody comes up with a heart attack. Oh, they had a clot. They did this happened, and so forth. And they're gone. It could have been something as simple as this. And I use this when I'm teaching doctors. Your patient comes in and they said, when were you first depressed? And they go back and they said, well, I've never been a happy child. So you dig a little deeper. They grew up in a good family. Everything was doing the way what they would want it to be. But they had this little dog, and this dog took off, and it got crushed in a car. And so because of their environment, they said, well, it's a dog. I know you feel bad, but that's the way it is, right? Those things happen. So that's called depression, an unresolved problem, an unresolved depressive type of situation. It's grief, and that patient is always in grief. They're always mourning the loss of the dog. And anytime that they see a car, they could at that point they don't want to get near cars or automobiles, and they're afraid to drive, and they have an anxiety that keeps up, and they get on, even going down the street with the car, they're scared to death. It can all relate to that dog. But in addition to that, if you don't find out that was the dog, and there's different techniques that you can unravel that. But see, this whole pattern now triggers other types of situations on an ongoing basis. So, you can have a serious medical condition as well, and that can lead to depression. Why? You can go, oh my, oh my, oh my, oh me, what's going to happen? I'm going to die, and so forth. So you go into depression, and now you're going to get sucked down that rabbit hole even faster, because we know that the mind makes decisions about whether we're going to survive or not survive. There are people that have gone into doctors' offices, and doctors have told them, I'm sorry, there's nothing that can be done for you, and you only have a short time left. And they buy that and they check out. On the other hand, there are people that go into doctors' offices and the same comment is made, and they say, who gives you the right to tell me I'm going to die? I don't think so. And then within a short period of time, they miraculously somehow resolve all their problems, and they show up at the doctor's office months or a year later, and there's no sign of anything, and they're in perfectly good health. So you have to understand that the mind is powerful, and there's ways of dealing with that. How about substance abuses, right? We can be dealing with alcohol, and that can exacerbate and lead to depression. How about drugs? How about fentanyl and all the things that they're putting in our substances? How about all the toxic reactions that are around us from, you get a conspiracy theorist like me, and you see the chemtrails, and we know there's barium in it, and I know what that does to the body. What happens if that's the case? So there's, you get into the literature, and they start talking about very specific situations, and they click them off as number one. They talk about stressful life situations, trauma, loss, isolation. Well, maybe, and there might be some genetic vulnerability, but I said that's very, very rare. And then medical conditions, but there's so much more than that. And this is what I really want to talk to you about. If there's more than that, where does it come from? Well, with our patients, when they come in and we're talking about anxiety and depressive states, the sadness, supposedly the depression, I don't want to do anything, it interferes with daily functioning and so forth and so on. Could they be depressed? Yes, they could very well be depressed, but what's causing the depression? Have any of you who have been diagnosed with a depressive disorder, have any of you ever had your doctor say, let's run a neurotransmitter test on you? A neurotransmitter. So what am I getting into? What is a neurotransmitter? What's that all about? Well, we know some things like serotonin and norepinephrine, and there's a ton of other neurotransmitters as well that have to be looked at that affect your brain and the cognitive capacity and so forth. So if depression is not just a single one and done situation, we really have to look at these things. We're going to look at serotonin, and we're going to look at GABA. We're going to look at other pieces of that puzzle, because those are things that are variable that most physicians unfortunately don't look at first. And then where do these neurotransmitters get produced? Well, we know that they get produced, the greatest majority of them are in your intestinal tract. So now we're going to where? We're going to the gut. Your gut. Why? Because those good bacteria, the microbiome, they're the ones that actually produce this stuff. So if your diet's terrible, and it has been for a long time, then the neurotransmitters like dopamine and norepinephrine and serotonin and GABA, and the list goes on, are not balanced. Even things like glutamate and acetylcholine and the like. So, the researchers, have been finger pointing this for a long time, and they're saying, hey, take a look at this. Your dopamine is that feel-good juice. It gives you your positive feelings that are associated with anything that you do. So we get hooked, if you will, on things that increase our dopamine and gives us that triggering mechanism. They're treating it now by dopamine withdrawal. Like people are on their phones all the time, right? And they're doing different types of games and so forth. They can't get off of them, and they're communicating with the outside world. That is producing a positive feeling, a reward reinforcement, and it's increasing dopamine addiction. So we have to be able to understand what these things do, but more importantly, how do we measure them? Well, there's a lot of ways of measuring them. We do it with urinary tests in the office. You can do it with blood testing and so forth. And now it comes down to understanding what these things are actually about. If you talk about something called catecholamines, which is another source, if you will, of these things that we're talking about. Serotonin, a neurotransmitter, that's your feel-good juice. Dopamine is, I want to go do it. Serotonin is, man, I feel great about that. That's phenomenal, right? In addition to helping regulate your mood, serotonin has a ton of other different jobs, throughout the body, and it's made, as I said earlier, in your gut. So what does it do? Well, serotonin, believe it or not, will have, it has a lot to do with sexual function and things of that nature, but it also has to do with depression dramatically. If your serotonin level is not normal, your feel-good neurotransmitter, then life ain't good. You're not feeling good about anything, no matter what it is. So there's things that the medical establishment uses, like Prozac and any of the SSRIs. Those are what they call serotonin reuptake inhibitors. So what they're trying to do is keep that serotonin in a good place and keep your mood in a better process. But wouldn't it be better if you can make sure that you had the capacity to optimize your serotonin on your own? You have to take a look at a lot of different pieces of the puzzle. But when we just, we go into things, say, well, take Effexor and we'll see if that happens. Or they go into the TCAs, where they're called tricyclic antidepressants. How do we deal with those people when they come into the office and we know that they have physical problems, if you will, that are associated with it? And the side effects are like horrific. Things, something minor like, a dry mouth And then they come in and say, my vision is blurred all the time. The first question I'm asking, are you on any drugs? Because they don't know why that vision's set. They're constipated. Primary consideration with any of these TCAs or SNRIs or SSRIs, they're all like that. And, then you have urinary hesitancy. You get a guy that sometimes he doesn't even realize what the doctor is giving them. And you can't get that stream of urine going. Women, same thing. Ladies, I'm sorry, but you don't escape this one. And so you're looking across the board at all of these different pathways, and you go and say, okay, what can I do naturally? And you go in and you're going to say, okay, you're going to take acetylcholine, or you're going to do some natural herbs. Some of them work, but that's by guess. Yeah, they can work repetitively enough at least a lower level, and we use them. But when we give them, we know specifically why we're doing them. So, what causes these neurotransmitter levels to drop down? Well, if you go into the medical literature, there's like no evidence that says that these guys are responsible for causing depression. Now, medical literature, what I'm talking about is traditional, medical drug-induced type of things. Why? Think about it. If they know how to fix the neurotransmitters and get you to go in to support your health naturally, there's no reason for them to write a prescription. And that's where the money comes in. Yep, call me the banker here, but I'm telling you, I understand why the motivation exists sometimes to put people on it. And we don't teach diagnosis the way we used to teach it in any of the schools. Unfortunately, I'm the guy that's going to, not only listen and ask you 1,000 questions, but I'm also going to look in your mouth. I'm going to look at your nails. I'm going to listen to you talk. I'm going to look at your skin. I'm going to do some neuromuscle function testing. I'm going to expose you in a muscle test, and we're going to see if that shows up. So that gives me ideas. And then we do urinary tests, and then we do blood tests, and then we find out what it is. Not just a blood test to see what your blood count is, but we want to find out what the neurotransmitters are. We want to find out what your inflammatory markers are. So a neurotransmitter is the communication between one neurological receptor and another. Okay, got it? It facilitates movement, and it combines down pathways to do other things. So, for example, if you want to have good serotonin levels, right, you have to have good magnesium malate and some B6, and then it goes into tryptophan and something called 5-HTP and so forth. There's a whole pathway that's involved there, and it can be very, very specific for you. On the 18th, Dr. P, and I ask her the questions. I'm going to kind of be the ghost in the background. I'm just going to be sitting there listening with the rest of you, and I'll answer questions as we go through if you have them. But I'm going to let them run with it, because these two really got it together. They really understand how you can begin to change. But wouldn't it be great if you could really suck it up and do some modifications and changes within your lifestyle that would make life a whole lot better? What if I told you that, that really feel good donut that you have in the morning that probably is putting too much weight on you anyway, and it's causing a sugar spike and dump. But that sugar spike and dump does this: it spikes and it dumps. So you need more to get it done. It spikes and it dumps. You need it more to get it done. It spikes and it dumps. That dump goes down lower and lower and lower and lower. The problem, and if we've talked about it before, anything that you put in your mouth that tastes sweet robs your body of different natural chemistries, things like copper and chromium and zinc and B complex and so forth. Now, if you did nothing more than start taking vitamin B on a regular basis and some magnesium malate with some B6, you might find that changes a few things. But I would suggest that maybe that you cut your sweet tooth down to about maybe 25% of what it is right now. And I'm talking about juices and fruits and all the other fast-acting carbohydrates. You've heard me do the drill before. So why don't we think about that? Wouldn't it be great? Wouldn't it be wonderful to get off of some of these crazy drugs that you're on that are having all kinds of side effects? The side effect levels are huge, right? So let's go back to depression for a second. I want to talk you through it. So depression, if you will, it's a mood disorder based on medical diagnosis. And if you go into the psychology literature, they don't even look at diagnosis relative to chemistries and so forth. If you meet these criteria, boom, 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 that you've lost interest in things, you don't want to do what you once enjoyed a lot, you have problems thinking, your memory's not there, eating and sleeping is altered, you're diagnosed with depression. None of those talk about chemistries. So if they don't talk about chemistry and they're just doing about how many of us go into, you get a run where I feel like crap and I don't want to do whatever. So they go to checklist. You have a high mortgage. Is your debt structure too high? Is you just get through a divorce? Did you just split up with somebody who you'd been with for a long time? Did you lose your dog? Any of those things, they stack on each other. But what they're doing, besides causing you an emotional spin cycle going down, because you don't have the tools to alter it, but they're also causing a shift, or there was already a shift in those neurochemistries that we talked about. So if you knew that there was a way out of the hole, does it really, do you want to spend your hard-earned dollars going to somebody that's sitting there and you're sitting in a chair, laying on their sofa or couch or whatever, and they have a piece of paper in their hand and they're saying, well, tell me how you think about that. What did you think about your mother? What did you think about your father? What did you think about that situation? I don't know about you, but how you handle that stuff is, what are you going to do about it? How can you change your lifestyle, get damn good and mad and angry, and then take the things nutritionally that will support that? Because as long as you go into that spin cycle, that down, the dirty hole spin cycle, it becomes much more difficult to do anything through therapy, if you will, my opinion, to pull something out. Now, there's things like NET, neuroemotional technique, that works to upregulate and release some of the stuff that's in your body. I tell patients occasionally when I treat them, because there's different segments of the nervous system, the spine, the muscle reflexes, and so forth, that when you normalize them, all of a sudden the patient is, they're 10 minutes out of the office and they're going to have a stoplight. They're waiting. All of a sudden they're madder than hell. And they don't understand why they're so mad. It's because it got released and it goes away just as quick as it came on. Or all of a sudden they're sitting there and they start crying and they don't know why, because their body released it. See, your body holds so much of this stuff and it continues to wrap tight. And pretty soon you can't get away with it. But here's the deal. We talked about one of the primary considerations in neurotransmitters. We talked about how the body holds situations. Every muscle, every organ, every energetic platform in your body has an emotion that is associated with it. We talked about the depressive patterns that alters breathing. That unresolved grief that can cause breathing problems. You can have something that affects your liver and you go into an anger pattern, and that's part of the puzzle as well. So if there was a way of really understanding that, and we're going to be doing that on the 18th when you come in, we're going to really show you, what these things are, but we're going to give you some dietary tips, little changes that you can make that will totally resolve the problem. Wouldn't that be a great thing? Wouldn't that be amazing if you could do it on your own? And then perhaps there's other ways to really resolve it. And that's what these two women are going to show you. Dr. Pina is amazing. She comes from a world of information that, she gives and she gives and she gives and she gives. And you can sit there, and Annabeth Goss has a credentialing that she gets it. She understands that that psychological cause that's there from neurochemistry, from the things that we shove in our bodies, that we should put in our bodies, and so forth. So, there are things that we've used over the years, things like even go get some lavender oil, right? And you can't sleep, and if you use lavender, sometimes it'll drop that anxiety level down that is the predisposition for depression in many cases. And now you can sleep. Wouldn't that be great? Wouldn't that be wonderful? So you got nothing to lose. It's not going to hurt you. There's things like kava. Kava is a relaxant, and it can drop down anxiety and so forth. And it has an effect similar to alcohol, but it doesn't have the alcohol addiction. It doesn't impair your function. It doesn't make you goofy. That works. It's not one of the things that I prescribe on an ongoing basis. Did you know that ashwagandha is one that's been used in Ayurvedic medicine and in the East for hundreds and thousands of years to bring down anxiety and so forth? But you have to look at that's adrenal induced, and it relaxes that system. It takes you out of fight flight and lowers that spin cycle. There's something called rhodiola. Rhodiola increases your resistance, if you will, to depression and stress. Get a good cup of chamomile tea and sip on that. Ginkgo. We know that ginkgo improves blood flow to the brain and neurotransmitters. It allows it to, get that serotonin and dopamine and so forth into the brain area. And then something as easy as rosemary. I think that's why my family they were always putting rosemary on everything. I don't know, but you can put it on meats, you can put it on all kinds of stuff. But those are just little things. There's tons of others, from St. John's wort to lemon balm to bacopa. They're all great, and I've used a lot of the first three for years when it comes to, and recently what we found out, this is a side vent for you, the St. John's wort, as I said, we use it ongoing and usually for brain function and depression and so forth. But now we found out that it has the ability to stop some of these secondary manifestations and infections as a result of long COVID and the COVID vaccines. Yeah, crazy, right? But it does that. But bacopa is another one that I've used forever. It's actually bacopa. You'll forget the mouth. And it's well known for enhancing cognition, your ability to remember. And sometimes I think I need a ton of that in my body, but it works really, really well. Now, having said that, please join us, and you can do it really easily. You can go online at drtomroselle.com. It's June 18th, 6 p.m. at the Roselle Center for Healing. And make sure that, if you can't make it, let us know. That's all. Just give us a call. Say, hey, listen. And sometimes we have the opportunity to send you some data. We never record these things, so if you want the firsthand information, you have to be there. We'll give you handouts, and you have the ability to ask questions. But we want to educate you. We want to give you the capacity, the ability to help yourself. That's the important part. It's always about you. So the 18th, you can do it online, drtomroselle.com. You go to rosellecare.com, or you can do it the old-fashioned way. Go to your phone, pick it up, go 703. Okay, 698-7117. That's 703-698-7117, and register. And please be our guest. I'd love to meet you and ask and answer any questions that you may have. Having said that, we'll have another program leading into this, and I'm going to be talking about some other things as well. Don't forget, like you were just on the radio program with me at 105.9 FM, WMAL. Always got some interesting stuff leading one into the other, right? So, and if you have a question beforehand, you can get a hold of me through drtomroselle.com. Having said that, you have a great day. And remember, I do this one reason only. I love you all. Take care. I'll see you soon.